Hello everyone, it's time for Chapter 10 of Health Promotion Disease Prevention. We're going to talk about schools and workplaces and probably get it done in about 2 to 3 minutes. So, schools. Schools are fantastic, young minds that you can mold and make lifelong changes. So they're a captive audience and you can reach a large number of people. Schools have hundreds of kids, or at least dozens, even the smallest school. Also, if you're working with kids, that means you're intersecting with families because families are closely involved with what goes on at school for the most part. Also, you can collaborate with programs such as health education, phys ed, school nurse's office. In fact, you can go back to page 85 and look at that CDC model about all the things that are at schools. They're great. Also, schools have tons of data about race and family income and who's in the door, so you know exactly what population you're targeting. And again, lifelong impact. Reach them young, get habits changed early. It's nothing but great. However, it's really not their priority. Health messages and health change isn't what a school system is for. They're there to teach kids a certain number of things, and obviously there's testing. They need to spend a certain amount of time. And honestly, teachers aren't going to want to give up their classroom to a non-educator, someone who doesn't have a background in teaching, because not anybody can just stand in the room and teach real well. You can talk and you can give a good PowerPoint slide, but being a real teacher takes training and practice that honestly you're just not going to have. And you're not going to be as good as the regular teacher. Also, the politics of working in a school are incredible, especially if you're in a controversial topic like drugs or sex. Just, again, that next bullet, you need to get all the approval from the school board, the principal, the department head, the teacher. You have to go through all of these levels to get in there and deliver your program. And again, you're probably not going to be as good as the regular teacher. I'm sure you're great, but you're not going to be that good. So schools, they can be great, but honestly, they're generally not the focus of your job because it is so hard to get in the door. And even when you are there, you've got limited time. So again, it's a nice to have, but generally not the focus of most of what we do, unless it's in an after school or a extracurricular type setting. Then there's more flexibility. But in the classroom during the day, it's probably not going to happen, or at least not very much. So then, but workplaces on the other hand can be quite different. Every workplace is completely different, and they all have different priorities. Whether it's a factory and it's occupational health, or it's an office in ergonometry and getting people moving and obesity. So again, depending on the environmental exposures, or the more just boring of people sitting all day. But employers are seeing that ROI, that return on investment, that for every dollar they spend on health promotion, that they get it back in reduced healthcare costs. So they're getting engaged, that basically physically active employees are engaged and alert and productive employees. And so they're willing to give up time and space for health promotion on their campuses. Again, the captive audience, they're there. People are at work 8-10 hours a day. They're there, and you get some real interest from people who want to make change. Again, communication support are already in place. They already have emails, and they already have ways to get messages to people, and they already have meetings scheduled. So again, all these structures are present. So again, it's there and it's ready to go. All you have to do is plug in your information. And of course, we talked about social network theory a few chapters back as great for workplaces, basically finding those key influencers and kind of getting them to take getting them and you're watching a program go from there. So, do your assignments. Again, the event flyer for Chapter 9 about trying to get people involved in lead screening. Unit 10 is, of course, about school-based. So trying to find a school-based intervention, like I said, it's hard, but can have a lifelong change. So see if you can find a best practice that can be implemented in schools. And there's a worksheet on that. And then the discussion boards. Week 9 is about social media, and what do you think is what's good and bad about social media and health promotion? And then week 10 is about workplace health promotion. That's all, and I'll talk to you all soon. Have a good week.